Okay, so thank you everyone for joining us today. So today, my name is Sasha Kalcheff-Korn. I'm Executive Director here at Relative Caring, and I have Dr. Swathi with us, who's not only Chief Scientific Officer at Element Apothec, she's an integrative health pharmacist, but now she's officially one of our Scientific Advisory Board members, which I am so happy about because you have done so much for our community and you've helped me with these webinars all year this year. And so it's just been incredible to have you. And what I would really love to do, because your background is so unique, so diverse when it comes to working in this world of CBD and cannabis. And I would just love to know a little bit more about your journey as an integrative health pharmacist and what led you to this space and helping people with their cannabinoid therapy.
Yeah, definitely. So, I mean, from the get-go, like I never thought I would be in the cannabis space necessarily, but I definitely from the beginning, I was raised around using Ayurvedic formulations and also thinking about Ayurveda from like a lifestyle perspective, because Ayurveda is one of the, oldest, if not the oldest ancient healing modality or methodology of medicine. And the entire crux of it is like food is medicine, spices are medicine, and really how you live your life and your lifestyle is going to translate to your quality of life. And so that's, we talked about that and using that in the house, but we use that just as often as, over the counter prescription and the more conventional side. So to me, healing, health, and wellness was always this very multifactorial, multifaceted process and very, patient-centric and personalized. So I went through, my entire pharmacy training and everything with that mentality and was looking for a mentor that I could, resonate with and that I could train with who also believed in that. Because, while I think cannabinoids and botanicals and other, nutritional strategies and everything are really pivotal and important for so many patients, I think that, they're not the only option. And, looking at the average American, average North American, everyone is not everyone, but a lot of people are on, quite a number of prescriptions and supplements, and they're looking at how they can optimize certain parts of their life. And maybe certain drugs are actually suiting them really well for, certain scenarios or conditions. And so a lot of what I feel like I do as an integrative health pharmacist is I try to help patients on their journey and figure out, what is working, what isn't. And sometimes, a patient will come to me, or a patient in the past has said, I'm good with these 3 medications, but I really prefer to not be on these 3. What can I do? Then there are other patients that are very much not wanting to take any prescriptions anymore. So how do they safely taper or, remove those medications slowly while adding on other things? And at the end of the day, it's really about patient-centered shared decision making. So that's the way I view it, is what does the patient want to achieve? What are their treatment goals? And then how can I play a role in that, rather than, coming from a deprescribing standpoint. And so that's how it kind of all started, was with this mentality. I found an incredible mentor who was the first integrative health pharmacist in the country. And I, asked to train with her, and we started the first ever and still only postdoctoral residency training program for pharmacists interested in pursuing this unconventional role. And since then, I've gone on to do everything from, consult with health food brands and CBD brands, all the way to, teach courses on Ayurveda or Western pharmacology at various colleges. And I've done quite a few different things. And in addition, being a principal investigator on clinical trials in the botanical medicine and alternative or, medical device space. So there's just a lot of, opportunity and potential in this space. And I think that more and more patients are realizing it as an evidence-based, scientifically driven option, which I love to see. And I feel like that's one of my goals with, the work that I do is, how can we promote the evidence-based perspective on all of this? Because, one of the things that we'll touch on very early on today is that, this is not standard, unfortunately, in a lot of healthcare professional curriculum. And, after my very conventional training, I had to go on and, learn the science behind the use of botanicals and everything as additional training, because it's something I sought out, not because it was necessarily something that was, a core part of what I was, learning in my curriculum. And so I really hope that we take notes from what our patients are asking and what consumers overall are asking and leaning towards, and playing a role as, clinicians in helping guide patients to make, informed decisions that are going to resonate with them and their lifestyle.
Thank you for sharing that. And I do love how you speak to both ends. You can speak to the healthcare practitioners as well as the consumers, the clients. That's really important, because I know we have a mixture of both on this call and who look at these webinars, because it's helpful for doctors who are helping clients who are using cannabis or want to use cannabis, and just make it a little bit more of a safer space. So just to sort of normalize this, because I know that we might all have had the same experience when we're hesitant to talk to a healthcare practitioner or provider about cannabis or CBD use. Why do you think it is that we are nervous or apprehensive to talk to a healthcare provider about it?
I think a lot of it comes back from the stigma and like the way that it's been viewed for so many years. And like, it's really fascinating. I was just speaking at Princeton at their annual, physician conference, so their primary care conference. And, one of the things that I think most people were so surprised in the audience was that there's actually such a long-standing medicinal use of cannabinoids in the US. And a lot of the history dates back to, even the way that it came to the United States as a medicinal product way back in the early 1900s. And it used to be actually prescribed by healthcare providers and dispensed from, apothecaries at the time, or, kind of modern day pharmacies. That's the way that it was initially used. And so it's amazing to go back and recount that story, because that's really how it started, and its initial kind of reputation in North America. But then, shortly thereafter, really what the issue was, and I think why a lot of the stigma still persists, is, a lot of providers were realizing that, oh, okay, if we use the whole plant, for example, it is possible that, patients can perceive it as, similar to a prescription. And the idea with prescriptions is the more you take, the more effect you get. And so, if they're getting a beneficial effect, then actually patients were taking too much, whether or not that was recommended by the provider. And so they started seeing a lot of the unwanted effects of cannabis, which, are the side effects, the adverse events that are possible when you take a lot of it, which, could be hallucinations, it could be, confusion, dizziness, all of those things that, patients don't want. And of course, providers want, they're always looking at the risk to benefit ratio. So that's the way I base all my decision making, is the risk to benefit ratio. And if the risk in my mind is more than the potential benefit, then, I'm not going to recommend it. And so a lot of providers, after they started prescribing and using it as a medicinal product, they were realizing that, oh, wow, there are some side effects. And then it kind of took the entire, the other perspective and went from a medicinal product all the way to the fact that, it's on the DEA, or the Drug Enforcement Agency, in their scheduled substances. And the plant itself still sits in Schedule 1 for most states in the United States. And so, when something is put in that category, it automatically has this designation of there is no longer any medicinal value associated with it, which is a problem, because as we know from science in the past few decades, from a lot of clinicians joining the space, that is not the case. But it has this perception because that's the way it's been discussed for so long, and it's been lumped in with a lot of other illicit substances that actually don't have research to support their medicinal use until more recently. And now we're finding out that a lot of substances that were put initially in this, Schedule 1, now actually may have potential for patients. And there's a lot of ongoing discussion of, okay, how do we change the schedules, or, modify them or deschedule, because they're actually maybe not there for the right reason. And so, I mean, that was a really long-winded answer, but the short version really is that I think there's just this long-standing history that it's been perceived as not having medicinal value, but rather just, recreational, quote unquote, fun value. And so providers don't want to necessarily be promoting something that, has this perception of fun rather than, medicine.
Of course. Yeah, no, I mean, it's a long time coming. I know we're working to fix, remedy the past mistakes and look at the medicinal value. It is definitely a long time coming. And it speaks to why we have that fear. It's just ingrained. That stigma is built within us. And so as we work to overcome it. And I know before we went live, we were talking about some of your trips that you've taken and this talks that you've given, and just how we are running into healthcare providers that really just don't know. They just don't know about endocannabinoid systems. So can you talk a little bit more about that?
Yeah, so that's one of the, biggest myths I love to bust in the cannabis space is that, the reason why when you speak to, like, let's say you're a patient, you're interested in speaking to your provider about cannabis, the reason why, if you might bring it up to a conventional healthcare provider, so like think about any specialist, any primary care provider that you're going to see, the average person that you're going to speak to has had no, actual core curriculum knowledge. So think about, what they've gone through in their schooling, their, residency, their training, all of that. They've actually not had any specific training about the endocannabinoid system. And that a lot of that goes back to, the pharmacy, medicine, nursing curriculums are very antiquated. Unfortunately, they haven't really changed for years, and they've been the same. And a lot of the, cannabis research and cannabinoid based, clinical medicine that's come out has been only in the past few decades. And so to update all of those curriculums is a huge feat. And I know that there are quite a few states and quite a few schools that are, working towards that. The first step being, let's incorporate an elective, let's incorporate, a guest lecture. So I get to be a part of some of those discussions, which is exciting, but it's not really a part of the core curriculum yet. And so if you approach any healthcare provider, the average one doesn't really know about the endocannabinoid system, but it's not because they don't want to. It's not because, it's their fault. It's just honestly the fault of the system and the educational, like curriculum that is there now. And so the people who do know about it, they have to go out of their way to learn about it, after they've graduated. And so, this comes back again to the risk versus benefit ratio that I mentioned before. So if you ask a provider and they don't know the benefits, all they know is the potential risks that they hear about in the media, or however they come about hearing about the risks. So they look at the ratio and all they see is risk, then they're not going to recommend it because they don't know the benefits. So I would say that if you're speaking to a conventional healthcare provider, it is possible that they will just tell you not to take it because they actually don't know the benefits. And so it's something that, that I'm really interested in changing, but also, I know Realm of Caring is also very interested in like changing the narrative around that and, playing a role in educating healthcare providers because, it's not that they don't want to know it. They understand. And the reason why I get so many questions like on the weekly or on the monthly from providers is because patients are asking them questions and they don't know what to say. Yeah. And, the worst feeling for a clinician or provider is to like not know how to answer your patient's question. And so in the heat of the moment, they're just going to go with the safest answer, which to them in that moment is no, because they don't know the benefit. But, a lot of them are reaching out and realizing that this is a void and something that they have to learn more about to actually be an effective clinician. Because, that's like, for example, why I spoke at that recent conference as the person coordinating the conference, who's also a physician, was like, we don't know anything and we need to know because, our patients are asking. And so like, some might be interested, but whether or not they're interested, they need to like come up with the time, so to speak, and the time say that like, we need to be able to respond to our patients.
Yes, absolutely. And just knowing that, so if somebody, is hesitant or a little bit fearful to talk to their doctor about it, but should they, if they're taking cannabis or CBD, a hemp-based product, or they intend to, should they be open with their healthcare provider about that?
I think the goal in that question really, or like, I guess the goal in my answer is like, if your healthcare provider is extremely anti-cannabis or anti, any, because there are a lot of a lot of providers now who like, they think of CBD because they see it in Whole Foods, they lump it in with all the other supplements. And another thing to actually note, while we're talking about this, is that there is, one lecture in like a 10-year program for a physician on supplements. So they don't know anything about supplements either. So now that like CBD has gone from, not just being, part of cannabis in the illicit category in their minds, now CBD is a supplement, they still don't know anything about supplements. So they're still lumping it in the same category, and therefore, they're not going to recommend it. And so it's just something to keep in mind, that if you are going to speak with your provider, and okay, first and foremost, I should say, you should always speak to your provider about cannabis or CBD or anything. But if your provider is very anti-supplement, if they're very anti-CBD, if they're anti-cannabis, and you get that feeling from them, they might not come out and say it, they likely won't come out and say it, but if you get that feeling from them that they're not really interested in hearing about your supplements, they're not interested in, figuring out if there is some potential interaction, then, I would suggest looking in your network and see what other providers are in your network that your insurance covers, because there is going to be someone, and there are more and more and more now these days, that are supportive of the use of concurrent, botanicals and, non-botanical, so conventional therapies. So I would say the first and foremost, for you to feel comfortable, because you should always speak to your provider about any sort of cannabis product, I think that the first and foremost thing to do is to find a provider that you feel comfortable with. And so as a patient, you need to feel comfortable with like everything you're going through, everything that, you want to share with them, because I'm thinking, again, I'm a clinician. So I'm thinking from the clinician standpoint, like I want to know the most information possible to make a decision that can help you best. And whether that's, providing, 6 different options, and then you pick which option is best for you, the more information I know, the better decision or the better options I can provide you to make the decision. And so if you think about it from that standpoint, it's like you're doing a disservice to you as a patient, but you're also doing a disservice to the clinician. And so, I mean, if they're uncomfortable and you're uncomfortable, then like no one's comfortable, and then that's not a very good scenario, right? So I think that if you have more providers in your network, if that is something, or maybe it's even within the same provider group, and it's not that particular human who like resonates with it, but there's someone else in the group that might, maybe it's something as simple as just staying in the group, but finding a different person you could speak to. So that would be like my first piece of advice for, you should always speak about not only cannabis, but all the supplements you're on, herbal, non-herbal, everything. But if your provider is not comfortable with it, or you don't feel comfortable sharing it, then I would say the next step is finding a provider that is.
Yeah, very important to also lump in the other supplements that you might be taking as well, because those sometimes that's not top of mind for people. If your doctor asks you, what vitamins are you taking? Are you taking any medication? A lot of people might not think to mention the ashwagandha that they're taking at night to help them
Which is
sleep.
extremely important, because that, like ashwagandha is a great example, can have a lot of potential drug interactions, just like CBD, just like THC, just like cannabis, which our last webinar was actually about like drug interactions. So, and the way that they work in the body. So it's a very important topic that very much gets overlooked when, you're asked to fill out your medication list. Oftentimes there's no place for you to fill out your supplements. So that leads me to like my next piece of advice is like, always keep a list of all your medications, all your supplements, and like all your herbal products, just like in a pad of paper. I mean, more often than not, I used to say pad of paper, but I guess now more often than not, I actually see people just keep a list in their phone under the notes category, and just keep that as a running list. and something that's very easily accessible. I mean, oftentimes we have our phone with us, so that's a very easy access point. Whereas, you know, if you have like a notebook you always keep with you or something, that's another option as well. But I would say, yeah, some sort of dynamic, you know, whether it's Google form, notes in your phone, something like that, where you can keep a list, because that is going to be a question that every provider is going to ask you. And the issue is, you know, with our current system is that if they're not in the same Kaiser system or the same massive healthcare system within that city, then, or within that state, sometimes, you know, things get lost between, you know, oh, what did I tell that provider? What did I tell this one? And if you don't have a consistent list on your end, it's really, unfortunately, in the US, it's really on the patient. There are a lot of other healthcare systems where it's almost, you know, in a system where that every single provider within the entire country has access to, which is a whole nother conversation for another time. And I love a universal EHR, but that's a whole nother thing. So I think like in the US, it's really on the patient to have those lists, because any provider you see, whether it's a specialist or otherwise, that's one thing they'll ask for. And I think that you just having a list of all the things you take regularly, and even divvying that list up to what I take regularly and what I might take once a month or once a week is important, because, you know, certain supplements, certain things, they do interact with medications. And we want to make sure that, you know, you are like, or even, you know, if you're taking certain drugs, there actually are certain scenarios where it depletes certain vitamins. So if we don't see that vitamin list on there, your provider might say, oh, if you're taking metformin, maybe consider taking B12 or something like that. So there's a lot of like potential opportunities for intervention in the best way if you keep that list. And it also just decreases the possibility of a drug interaction or some sort of unwanted side effect.
That makes sense. And so along with having that list of the medication supplements that you might be taking, is there anything else that individuals should be prepared when they go in to talk with their doctor? Should they have some research pages? What tools would help them be more successful in their conversation?
So that's the number one thing, is that list ready to go. And if you keep that list, you know, up to date, and just, you know, whenever you go to the doctor next, if they change a dose, that's the other thing too, is when you have the medications, also have the dose, because the dose is very important for the way that, you know, it might interact, because there might be interactions at certain doses, but not at other doses. So yeah, I did want to kind of say that as well, is that when you have the medications and supplements, also have the doses. But other things that are super important is, you know, one of the things that I think is really important as a clinician is to ask why. So, you know, if you're interested in taking CBD, ashwagandha, passion flower, anything, why do you want to take it? Because that is something that I found that has been really eye-opening for me, is that someone's like, oh, I want to take CBD. And I'm like, okay, why? And actually this just happened last week, is someone wanted to take CBD and I asked why. And they said, oh, I heard that it's really good for appetite stimulation. And it's actually, appetite stimulation is THC. So if I didn't ask that question and I just gave them a good dose of what I think CBD, because they gave me their medication list first, and I saw with their medication list, I was like, oh, that's safe to take CBD. Absolutely. But then when they told me why they wanted to take it, I was like, wait, no, please don't take CBD, because that can actually do the opposite effect from what you're looking for. They were looking to gain weight. Right. And so I was like, okay, well, if we want appetite stimulation, then we need to actually look at THC products. And I was able to recommend like a great THC product for them. But, you know, certain things like that, where patients know a certain amount of information, but there really is that, you know, opportunity to educate in that scenario. So I would say, like, not only having your list of supplements, all of that, but like have your why. Like, why do you want to take it? Where did you hear about it? You know, like what sort of and then the next thing, you know, kind of on that line that the clinician will ask you is, what products have you tried so far? Very similar to the question of like, oh, you know, like I just got my blood pressure checked. The next question will be, what medications have you tried for blood pressure so far? So it's the same type of, you know, line of questioning. So with, you know, cannabis products in particular, like what products have you tried? And, like if you can, write down the brands, those kinds of things, keeping track of those is very helpful, because then we won't recommend a product that you've already tried, right? So then that's really helpful. One of the other things I recommend, especially as you're trying different supplements, you're trying different cannabis products, that you keep it like what I call like a cannabis journal, or like, like a supplement journal. And so as you're trying these different products, whether it's actually like a written journal, again, whether it's in your notes, whether it's in a Google Doc or something like that, just keeping track of what products you've tried, and then how each like product makes you feel, how each dose makes you feel. I mean, a lot of products now come in, like gummies, or, different like amounts that are very set dosage, or like tinctures. You can have, the graduated pipette. So you know exactly, oh, I took half, or I took 0.5 mil. And then you can really evaluate how that made you feel. And I think that that's really helpful on the path to figuring out what products are good for you, what doses are good for you, and those types of questions. So the preparation really comes from, like, why do you want to take it? What else are you already taking? And what have you already tried? Are like the top 3 questions that you should just be ready to answer, because those will be like probably the first 3 questions that they ask you.
Very good. Very good to know. And so the next lump of questions comes from that kind of fear talk and the stigmas. So individuals are worried about being turned into law enforcement. Will they be dropped as a patient? Will they not be allowed to refill certain prescriptions? And so I guess that could speak to both sides, the CBD side or the THC side, because if you're a caregiver, you're giving to a child. So if you're having these open conversations, do you have to have these additional worries with that?
So I think that comes back to having that patient-provider relationship being really strong. So like, I would hope that as a patient, and also from a clinician side, that neither of you would be worried about something like that, because both of you would feel comfortable being open and honest. So I think that a lot of those worries can be kind of, qualmed if you're able to find a provider that you feel comfortable with being honest with. Because, and also like some of it, I think will come down to what state you're in. Like some states, they only have, medically grade available. They only have the medical designation right now. And so then, it is, they are, of course, clinicians are thinking about their license. And so, when you are going to a provider, that is really important, and finding, like in a state where, for example, it is medically legal, to ensure that if you are speaking with a provider, to have, the right, whether it's a license or, some sort of, certification, different things like that. So I think that that's really important. But again, finding a provider you can trust is the most important thing. And what I find in states where it's only medically legal and it's not recreationally legal yet, a lot of the patients that I've worked with before, that I've spoken to, they actually have a medical cannabis provider. So they actually speak to someone, unfortunately, separately about their cannabis, versus, and this provider, hopefully, in most cases is either, a nurse or a pharmacist or a physician or some sort of, mid-level provider. So, they do have a more well-versed background as a conventional practitioner, but then they're able to integrate the medical cannabis, information. So I guess a lot of this is nuanced, because it's a bit based on where you live. But if it's not recreationally legal and you're looking for certain products with THC, then I would say that it's important to have, a medical provider who has a cannabis specialty in those scenarios. I mean, the other thing that's good to mention too is that, a lot of these providers are now more easily accessible due to telemedicine. Mm-hmm. And so that's also something too, if you're worried, oh, I live in a rural area, but it is medically legal in my state. Like, what do I do? How do I find a provider? Do I have to drive 3 hours to see one? And, one of the silver linings of COVID in the past few years is that a lot of providers have kind of shifted some of their practice to online. And so, especially some of these more niche providers that, you might want to work with, that would be one way to contact them and work with them to make sure they are licensed in your state. And then you're able to connect with them online.
Yes, absolutely. And that's a great point about telehealth too, is just you do have a larger pool to pull from if you are a
Yes.
patient. And then so one question too came in about interactions. I know we've talked about this in previous webinars as well, and so we'll make sure to be linking those when we put this out on YouTube. But so what are the main interactions that you see with patients? So that way also for, I think for, it's important for both sides, for the doctor, right, to know what to look for, but then also for the patient side to understand if they're starting to experience some, weird symptoms that they haven't noticed before and wondering if it could be an interaction. So what are the kind of main ones that they should be looking for?
So there are a few what I call like red flag medications that like if I, of course, before I recommend any cannabis, any supplement, I review medication lists, supplement lists, herbal lists, all of those lists. And then of course assess, is cannabis right for this patient given their medication list and given their treatment goals, as I mentioned with that previous patient who wanted to, take CBD to gain weight, which is, scientifically not sound. So I was able to provide that insight. So, it really comes down to, what is the patient looking for? And then how can I help provide the insight? So, can you hear me?
Yeah. Did we go away? Can you hear me?
Oh, no, I think you're back. I think
Okay.
like I must have been getting a call. I apologize. Do you
Oh
mind
no.
repeating the question?
Oh, so what are the main interactions that someone could look
I
for?
mean, yeah. Okay.
Yes,
So,
yeah.
yeah. Sorry about that. I
No,
think
no.
everything's fine now, though, right?
Yes, yeah. Perfect.
Okay, good. Okay, so yeah, the main interaction. So yes, again, it really is about like what the patient is taking and then assessing is cannabis the right fit. So once we get to that point, then thinking about drug interactions. So, there are some drug interactions that I deem as like a red flag medication, and that those are some of the medications are warfarin. So warfarin is an anticoagulant or a blood thinner, and another one is clobazam, and another one is valproic acid or Depakote, and those are considered anticonvulsants or anti-seizure medications. Those are like some of the top three that if I see that on a medication drug list or anything, to me, again, it's all about benefit versus risk. And to me, the risk outweighs the potential benefit. And so I will have to say no. But given my background as an integrative pharmacist, I can say, okay, maybe not cannabis, but like, let's think about some other potential options that could be a good fit for you. So those three are definitely red flags. Any sort of transplant medications as well, like you might recognize, tacrolimus, other, medications that look similar to that. Similar to that spelling, those also again pose potentially more risk than benefit, and so I would not suggest that patients be on those medications and looking to integrate cannabis. So those are just some of them, but as we mentioned, and you'll link the previous webinar, I mean there are different scenarios. So there are some scenarios where if you take cannabis with a certain drug or you take CBD with a certain drug, it actually happens where that drug gets in the way of the breakdown or metabolism of CBD. So then in that case, you want to select, which is more important. And so, in a lot of scenarios, the patient is on XYZ drug for a certain reason. And so if they take both together and the concentration of cannabis is changed in the body because of their interaction, then we can optimize the cannabis dose based off of that. So if we know, okay, they're taking both together, it's not a be all end all that they're taking it together. Instead, okay, let's increase the dose of the cannabis because we know that they're taking both together. So there's a bit of that like kind of specialized and personalized, kind of necessity with cannabis if patients are taking prescription drugs, but it also works the other way of there might be an opportunity where someone is taking cannabis and a drug, and cannabis then influences the drug concentration. And that's the scenario I talked about with the red flags where, someone might be taking cannabis, but they're taking warfarin. and it can decrease the amount of warfarin in the body to the point that your body doesn't even recognize warfarin anymore. And then, you have issues with bleeding. And so that's, of course, a situation we don't want to put any patient or person in ever. And so it really comes down to the patient and scenario, but I'm definitely more concerned when cannabis and drugs are taken together and cannabis is completely like almost canceling out the way that the drug works. Whereas if it is the other way around, we can kind of optimize the cannabis dose to be increased or decreased depending on the scenario. And then we can still safely incorporate cannabis or other supplements. So very case by case scenario, but at least I gave you a 3-4, kind of classes of drugs that I worry about sometimes.
Absolutely. And so for this sort of goes with that, and so does the next question that I have as well. So as far as resources go, so for resources for doctors, say you're sitting in their office and they want to check a drug interaction just quickly while you're there. Vice versa for the patient, if you kind of want to check something on your own before heading into your doctor, so you can kind of come in with that knowledge of, I looked it up and it seems to be okay to take CBD with this medication I'm taking, as an example. What is a good resource to turn to for that? Is there something online that people could just check that is somewhat accurate, at least?
That's a great question, and is honestly like a white space in the market right now, as far as I can tell. There really isn't a good drug interaction checker with cannabis right now. There are great, online, resources to learn about cannabis. I'm happy to name, a few, like in an email or something, like definitely. But right now, to check a drug interaction or drug herb interaction with cannabis, unfortunately, there really isn't one that I can think of as like a gold standard. And part of that is not, the issue with the drug interaction checkers themselves, but like the necessary, research that we need to then that will fuel the checkers. So, and I say that because most of the research even I talk about with drug interactions are only really done on CBD and THC, not really looked at, the minors. But, if we know what we know about the way that they're broken down, we can make theoretical assumptions, like very informed, kind of educated assumptions. But at the end of the day, we really only know about CBD and THC. And the problem with a lot of those trackers is the people who are creating them don't really know the difference between CBD, THC, and cannabis. So they'll just put in cannabis, and then a bunch of stuff will come up that maybe actually only interact with THC and don't actually interact with CBD. But they kind of lump them, unfortunately. And even some of the people doing the research too, which even if you read it, they'll say, oh, cannabis drug interactions. And I'm like, that's like comparing, like, if you think about it, like a pair of pants, it's like comparing the whole pair of pants to like, the buckle or something. Like you can't, like, do you know what I mean? It's just like, it's not really comparing apples to apples. It's comparing like an apple to a pineapple. Like they have this similar name, but it doesn't necessarily mean they're the same thing. So, yeah, it's complicated, unfortunately. And so there isn't really a great resource I would recommend right now. I know people working on, kind of solving that issue and that white space, but I don't think any of them are kind of at the caliber that we need right now for me to be recommending.
Sure. And that, that makes sense. It's all still a process. We're still learning, growing, more research is being done. And so we'll get there, but just maybe not yet.
Yeah, definitely. I'm optimistic that we'll get there, but there's just a lot more that needs to be kind of fleshed out first.
Absolutely. So how often should you check in with your doctor? You've already had the conversation about the CBD or cannabis use. And if you're using a medication, does the need to check in with your doctor more often increase? Are there other things you should be doing with your doctor? Are there different blood serum draws or enzyme tests or how often should you be checking in with your doctor?
I would say, it depends on, what part of your cannabis therapy you're in. If you're starting in initially, a lot of the, questions and everything that you may have can be, you can do your background work, and background work, I mean, you can do, like keep all of your journals, all of your, cannabis diaries, all of your supplement diaries, all of those things up to date. I think that's kind of the thing you can do, on the daily, weekly, to keep track of all the products and what you're taking, how effective you feel like they are or they're not. And then I would say every time you have an appointment with your healthcare provider, make sure to, update them on, what products you're taking. Again, if your list is up to date, if your diaries are up to date, then you're good to go. But I think that is really key, is every time you meet with them to talk about it. And then, if you are meeting with a medical cannabis specialist or someone who knows a bit more about cannabis, then I think that they'll have a bit more of a set, cadence on like how often you'll be meeting to talk about changing doses and, your therapy and things like that. And one of the things that I really like too is when providers make themselves available, whether it's them, whether it's someone that they work with or who works for them, or someone else on their team, to be able to, I think that's like one of the things you should look for actually when you look for a provider, is whether they can make themselves available via email, or if someone else on their team can make themselves available to answer you within, 1 to 2 business days or something like that. Because if you do have a question, you should be able to turn to a healthcare provider that you trust. And sometimes those questions you don't warrant, another visit, or whether it's telemedicine or in person, but rather it's just a quick question that you can ask them via email, or some providers also do via text, that are all like HIPAA compliant texting, not just like texting normally, but, like through a message platform, through, a HIPAA protected email address, different things like that there are ways that you can do that. But I would say that should be part of your vetting process of a provider, is how available can they make themselves or their team, just in case I do want to ask a quick question, rather than, setting up another appointment.
That's great, because we're also at Realm of Caring, we're all about the vetting process, just ensuring that your care is of quality, that your product is of quality. I'm totally on board with you with that. So this individual, someone wrote in about their child having seizures, and they have a neurologist who's against cannabis. And so for this parent, would you advise looking for another neurologist, or taking the route of trying to educate them? Because I know we've seen it both ways at Realm of Caring,
Yes.
where we've seen the parent advocate educating their neurologist, or trying to find somebody new. So what's the best advice for this parent?
So I would first and foremost assess, like from the, I'm not there in the meetings or in the appointments. So I would say I would like the parent to assess, what they think, like from their, interactions with the provider, from the interactions with their neurologist. Do they think this neurologist is going to be open to something like that? And if they think that this person could be open to it, then I would say that could be your moment for, education. However, it all comes down to that provider and what that parent thinks. Because if the parent thinks that, okay, this provider might be open to it, given our past interactions, given the way they've interacted with us, maybe some of the suggestions they've already made, versus, if you think that they might not be open to it, I would suggest changing neurologists. That's certainly the quote unquote like safer option, I suppose, is, maybe the simpler option is choosing someone else in network. But if you think the person would be open to it, I think that there is, a great opportunity for education. And I'm also happy to step in. I've done that quite a few times with different specialists where, maybe they want to speak like clinician to clinician. So I'm happy to be that bridge. If you also just want to, contact Sasha, she can reach out to me and we can connect. And I'm happy to speak to that provider as an option. But I would love for you to evaluate on your end, given your interactions thus far with, he, she, them, whomever, to figure out, like, do you think this person would be open to it first?
Absolutely. Yeah, it's really important too, just to talk about the openness of it and still have that conversation. We also find, because sometimes it's not even the neurologist, it's just the hospital system that they might be working for. It's their policy that they can't talk about it. And so It might not
Which
be
is
that.
fascinating
Yeah.
though, because the only FDA approved CBD, especially plant derived CBD product, is for epilepsy.
Yeah. Yes. Right.
So and that's very fascinating that from all providers that a neurologist would be, be
The
potentially
naysayer.
not open to it, because there actually is an FDA approved product that is plant derived. That's the other thing too, when I try to bridge and start even the discussions with providers, is to say, there are FDA approved products that are either, cannabis derived, or cannabis inspired is the other term I like to use as well, because in 1985 there were two medications approved in the same year, so years and years ago, so decades ago at this point, that were FDA approved for specifically CINV, so chemotherapy induced nausea and vomiting, and that's nabilone and Marinol. So they are scheduled 2 and 3 respectively, but they are used very, very widely, and they're very widely accepted. However, I think oftentimes people don't associate it with cannabis necessarily, because one is a THC analog, so it looks similar to THC, but not quite. And another is like a synthetic version of THC. So they're not plant derived. So they've kind of been removed from the discussion, if you will, around cannabis. But at the end of the day, like, where else would they have gotten that idea? The plant. So, like, that's kind of like, sometimes when I'm speaking to providers, I'm like, you might not be using it as a neurologist right now, but, since 1985, it's been pretty often used within the realm of oncology, which is, I think, why overarchingly oncologists are more open to the concept of maybe using cannabis for like side effect management, for like any adverse events that are associated with chemotherapy, because there is FDA approved, or rather there are 2 FDA approved products already on the market for that they definitely learned about in school. So that's also like a great way to, if you're going down the education route or anything like that, is that there actually are FDA approved products that are cannabis derived or cannabis inspired. And of course, the third one being in 2018, Epidiolex was approved. That's what Sasha and I were just alluding to, is that there's Epidiolex, and that's actually a plant derived CBD isolate. And that was FDA approved or indicated for 2 rare pediatric seizures, and also now approved in adults as well.
Yeah, that's great context to have. So we had a doctor that asked, and let's see, we still have a little bit of time. So what is the best way to bring up cannabis with patients when I don't know if they're open to it, but I believe that they could benefit?
I think it's kind of the same answer as the previous one, is like, given your previous interactions with them, given, their reactions to your other suggestions, like, I think that's something for you to kind of assess on a patient by patient basis. And if you think that they might be open to it, I mean, another way also is to evaluate, maybe like recommending another supplement you think could be a great choice for them, and kind of see how they react to the supplement or something like that, kind of like as a path down the discussion. That's just an idea, but it would come down for me to like the same type of answer as the previous one, of like, do you think they'd be open to it? How have they reacted to other things you've maybe suggested? And then go from there. I think if you think it's going to benefit the patient, I'm always in favor of providing it as an option. You don't necessarily need to advocate and say like, this is your only option, but providing it as a potential option, I think is always great, especially from a clinician perspective. If we think that it could be a good fit for them, and it is safe with, their medication list, their lifestyle, their other, aspects of who they are and their treatment goals, then I think that it wouldn't hurt to bring it up, but I do understand the question and why you don't want to, kind of compromise a patient provider relationship that you've cultivated. So I get where the question is coming from, but I would suggest, if you think it's appropriate, to recommend it.
Yeah, definitely. And so we touched on this before, peppered throughout, where we talked about journaling and tracking, but I think it's really a really good point to stress on. I know you feel the same way. So I think to round us out and round out this conversation. So after you leave the doctor's office, what do you take home with you? How do you track your progress at home? How are you evaluating different products? How are you evaluating how you're feeling, to decide what the next steps are? So what can we leave everybody with for what to do when they're at home?
Definitely. So even before we get home, we can talk about even during the visit, like do not be afraid to bring, a notebook, a pen. I mean, I guess I'm thinking about myself because that's what I would do, but I guess other people would maybe bring like a, like a, not a Kindle or like an iPad or like
yeah.
a phone or something. And don't be afraid to take notes during the appointment, because there might be a lot of stuff discussed. Like if it's a medical cannabis appointment, it might be a bit longer than, kind of a conventional PCP or a primary care appointment. So I would say, like, regardless of how long your appointment is, like write down notes during the appointment, because I feel like I've done this many a time too, when I like, even when I go see my providers, where I think that I'm going to remember everything, and then like 15 minutes later I'm like, oh gosh, I know they just told me but I don't remember. So I would just say, like, take notes throughout the entire appointment, because then you can always refer to them later. Again, if you have like a provider that you're able to just like send a quick email to, or just phone in really quickly, or send a quick, text, then you can always triple check, something that you've maybe written down. So I would suggest, like, during the appointment, even before you leave, like definitely do that. And, don't be afraid to write down. I mean, like, the provider should definitely not be weirded out by that by any means. So I would say that would be my suggestion during the appointment. And then, after the appointment, as you mentioned, it's really about just tracking your progress. And it's, thinking about tracking your progress and journaling, just like you would journal in like normal life for other things. It's like just keeping tabs on things, writing things down, and then you're able to reference them better later. Because it's also really incredible from a patient standpoint to think about tracking your progress and like see your improvements. I think is also like a really great, almost like positive reinforcement too, that I think has served, people I've worked with, but also like myself as a patient too, to be like, okay, like what progress and path have we taken to get to where we are now? I think also in the course of trying different products, whether they be supplements, CBD, otherwise cannabis, there are just so many products out there. And I mean, this is a whole nother conversation about how to pick a good product, but right. As you're going through and like trying these different products, I think it's possible over the years that you might forget that you've tried a brand that maybe a few years ago you did try. And especially now, like, brands are changing their packaging all the time. So even just to remember that, the packaging was pink, it's like maybe the packaging wouldn't be pink, 2 to 3 years later. So think about too, like, just everything that you've tried, just keeping a log of everything you've tried, because you might want to refer to it like a year or two later. Maybe you'll never refer to it. It's also totally possible, but I would say just to stay on the safer side, and again, to be able to answer your provider's questions to help them make the best, educated decision for you and for your health too, I think is really important. So think about it as not just helping you, but also helping, your provider or your care team also help you and helping yourself. Yeah.
Yes. Well, that is a great way to leave us. And so for everybody who's watching, we are going to have this recorded and uploaded to the client portal and sent out through email. And if we didn't get to your question, or you have additional questions, just make sure you get it to info@realmofcaring.org. And then we will pass them along to Dr. Swathi as requested. So thank you for joining us. Thank you, Dr. Swathi, for joining us as always. And I love that we even have an idea for the next webinar about looking into quality products. So maybe that will be the next one we touch on.
So much to say about that. So much to say, yes.
Yes, absolutely. Well, everybody have a great Thursday evening. Be well. And thank you again for joining us.
Bye.
Bye.